All right, so this next skill is we're trying to simulate an athlete with a bloody elbow. So this skill is what we use, what we call like on the field, when somebody comes off the field or is taken off the field from the refs, with some type of blood injury. And so we quickly want to identify the wound, and like how significant the wound is. Quickly get it wrapped so the athlete can get back in and play. Okay, so what we want to do is emphasize like some of the things that we may need, and we've got some just general bulk gauze here and some non-stick gauze. We've got our gloves, and then we're even going to use a little bit of Coflex. And so what I obviously stress the universal precautions and have your gloves on. And when we're on the field, we kind of use this as it's two people can be doing this at once, and even the athlete can be somewhat proactive and help out. So like if they're bleeding pretty good and I'm trying to get my gloves on, if I had like the gauze out first, I might just hand that to the athlete first and just give it to them in their non-injured hand and tell them to put it right on the wound. So that tape was kind of representing the wound, and have them do like direct pressure, so then we can get our gloves on, we're ready to roll. So once we've got our gloves on, we've got our barrier, then we can go ahead and the athlete can go ahead and remove that, and then we can identify the wound. And so I'm just going to pretend like I was on the field, and I would drop the gauze. I usually throw it down at my feet. Now what I like to do is either wet gauze with water, with a water bottle, or actually even just spray the wound. And if I'm doing that, I want to be conscientious of the athlete in terms of where their body or arm position is, because I don't want to spray this and blood and everything's going to be dripping down on their uniform. So again, kind of having it out here where we can spray it, because this day and age we're all playing on these turf, or fake fields with all those rubber pellets and stuff. So I just want to identify the wound, if it's deep, superficial. In most cases, thank God, we generally talk about superficial wounds here. But identify the wound, clean it out. And I might, again, a little water with the water bottles, or using the gauze. And so let's say we've cleaned it and we're trying to dry it off, so we dry it off. I don't like to use this gauze and leave it in place. So what I'll do is, as I dry it off, again, I'll just toss that, and then I'll throw non-stick, just a non-stick gauze in there, super quick. You can have the athlete help out by holding it in place there. And then I've got some options. If I've got the tough skin really quick, then I'm going to quick spray around the arm. And then I generally don't use pre-wrap in this situation, because then I'll use like this Coflex type of tape, and basically I'm just going to start distal and work my way proximal and hold it in place. And it's quickly, we're trying to do this so we can get the athlete back into play really quick. All right, so so here we are, we're just going to have the athlete hold that in place, and so they're being helpful, and we just continue to spiral on up, so overlapping. And in this case, we want to make sure that we go past the elbow joint a little bit higher. There you go. And then you could just rip this off. So then the nice thing about this type of tape, it's functional, right? So they can move around and everything's cool. Then they can go back in and play. Now if it's a deep wound, we're talking a little bit different. If it's going to require some other medical emergency or treatment. In this case, these are just generally done for superficial wounds, quick to get them back onto the playing surface. So same thing, we could do this if it was on their knee or anything, but most of the times when we're looking at types of superficial wounds out on the field, it's usually like arm, knee. Okay, all right. So this is a skill we want our students to learn and be efficient and proficient in. So like when they're in this situation, they can take care of this out on the field and use, like I said, universal precautions. And so also, like when we're done with all of this, we also want to make sure that the athlete, then we can quick wipe by have a Perel out on the field. We also have Clorox wipes too as well. And then we want to make sure the last thing is that we pick up all of our garbage and all that. Okay. For the sake of just reusing this, here, I'll hide it that way. I'm not going to tear it off. Okay, so we're done with the tape job, but like I said, picking things up, let's just kind of go over our, picking up our garbage. And so if I had anything that was used, I kind of all have it in the same place, and I, wad it all up, and then I just go through the process of taking the gloves off properly, right, and balling everything off inside. So there's that. And then I can go ahead then and take this other glove off. And remember, don't touch the surface of the glove. And we're just going to go ahead and spin that off there. And then you want to dispose of that properly. And then, of course, clean your hands after you're done too as well. Okay? So again, that's what we refer to as our kind of quick blood skill when we're dealing with a superficial wound out on the field. Okay? Cool.